We're going to be supporting state efforts. We're going to be working with them to make sure that those great retailers, which are CVS and Target and Walgreens and Walmart, that are opening their parking lots for drive-through centers, are included. But the American people can be confident that now that we have the commercial labs around the country with those high-speed automated tests, you're literally going to see tens of thousands of tests in the days and weeks ahead for the American people.
All right, let's bring in Seema Verma now. That's the Vice President of the United States last night with Sean. She's the administrator of the Centers for Medicare Medicaid Services and member of the White House Coronavirus Task Force. Seema, always great to see you. And let me ask, I was a little surprised and kind of heartened by the fact that you guys are expanding. You're going to have telemedicine for our seniors. Tell us how this will work.
Well, that's right. The president made a very important announcement yesterday that we are expanding telehealth services to our seniors in the Medicare program. So that's about 62 million Americans. And this is really important because last week, or actually just earlier this week, the White House has been pushing out information, 15 days to slow the spread of the virus. And we've given recommendations for the American public about the measures that they can take to prevent the spread of the virus. And part of that is avoiding situations where there's more than 10 people, staying at home. And this is especially important for America's seniors that have underlying health conditions. With telehealth, they can now get to see their doctor, talk to their doctor, and they can do that from the safety of their home. In the past, Medicare only paid for telehealth services in rural areas, very short visits, and it also required them to have a long-standing relationship with their provider. But now, with the coronavirus, we're expanding telehealth services. And this is really important for a couple of reasons. Number one, it helps our healthcare providers focus on the most, people that have the most dire healthcare needs. Secondly, it keeps people safe. If you're a diabetic patient, you may not even have any symptoms, around the coronavirus, no respiratory disease. And if you come into the office and you're sitting in the waiting room, you're having to travel, you could potentially get sick. Number two, for people that are showing symptoms, it's better for them to communicate with their doctor through telehealth, and that means they're not infecting additional people through their travel to the doctor's office or by sitting in a waiting room.
Now, Seema, are you worried at all about running out of medicine? We had a conversation as a family. My mom's a diabetic, and my sister said, do you think they'll run out of insulin? I said, well, I don't think so, because they're making just as much as they were before. Can you answer that?
Well, I think people have concerns at large about medical supplies, treatments, but right now we haven't heard that there were any issues in terms of the insulin supply. I think more of what we're hearing is that people are concerned about supplies to address the coronavirus, and that's why the president and the vice president met with manufacturers yesterday about increasing the production of certain types of equipment, ventilators, other supplies, and the DoD is donating equipment as well.
Right.
I'm sorry?
I just said right. Sorry. Seema, I've got a question for you. You held up that thing that said 15 days to slow the spread. That is so important, and that's why we're social distancing, and that's why the country, for the most part, is self-isolating. And these are hard times, they're challenging times. But this lockdown of 15 days really is going to shape the trajectory of how this disease impacts the United States for the next 2 weeks and maybe even longer.
That's exactly it. I mean, we can either be Italy or we can be South Korea and also look at China. They're really seeing their numbers go down. So it's really up to every single American to come together to follow these guidelines. And if we all work together, we could see a flattening of the curve. And this is really important because our healthcare system would be overwhelmed if we have the degree of infections or the rate of infections that we've seen in Italy. And that's why the White House has put out these recommendations. It's going to be difficult for people to make these modifications, but it's important that we all work together, especially younger people, millennials. They may feel healthy. They may feel like if I get this virus, it's not going to be that big of a deal. It's just going to be like the flu. But the reality is they can contribute to the spread. They may not even be showing any symptoms, but they could spread it to other people that are more vulnerable, those with underlying healthcare conditions especially the elderly in that case. And so it's important that we all do our part.
Seniors got to get used to something new, as we all did. Telemedicine is it, and you're the one who's making it happen. Seema Verma, thanks so much.
Makes it a lot easier on them.
My
They don't have to
pleasure.
leave the house. Thank you so much, Seema, for all that you do.
Thank you.
Yeah,
You're welcome.
15 days sounds a lot better than August, so let's hope for that. Let's be disciplined.
Yep.